Ciao Mundo, hello world, hola mundo, hello mon. We are here today taking a cappuccino with Professor John Kellum from Pittsburgh, 1 year after we spoke last year about cell cycle arrest biomarkers, and we're still in San Diego for a CRRT meeting, and we would like to ask him about the new Critical Care Nephrology Center that he has opened in Pittsburgh. So, John, why this center and why is everybody so afraid about AKI?
Well, so I think the two are related. So we opened a Center for Critical Care Nephrology in Pittsburgh, in large part because we think this is a disease process that requires a multidisciplinary approach. You're a nephrologist, I'm an intensivist, and we've been working together for a few years now, more years than we care to remember. Together with radiologists and cardiologists and pharmacists, we have really tried to focus on, not just you and I, but across the globe, tried to focus on a multidisciplinary approach to
what we called many years ago the Vicenza Model. You remember?
Indeed. So it's becoming the Pittsburgh model as well, and our approach has really been to try to focus on not just patients who develop acute kidney injury, because by then, for some patients, it's too late to make an effect, but also to identify patients at high risk for acute kidney injury and get out in front of the problem and try to make a difference that way. You know, in Pittsburgh, and I imagine in Vicenza as well, we have many patients that are on multiple medications, that they develop an acute illness, and you have the combination of nephrotoxicity from the medications and the acute illness. You may need to undergo radiologic procedures with IV contrast. So there's a lot of different things happening, and it really requires a concerted effort across not just one specialty or two specialties, but really involving many people.
So do you think that compared to last year, we have any new specific about biomarkers and how this can help us to evolve in the therapy of these patients?
Well, you know, every year, every month, every day, I think we get a little bit closer to where we'd like to be in terms of understanding how to care for these patients, how to identify them early. And you know, I think it's really going to require that kind of experience. I mean, I think when we started this whole process with the cell cycle arrest biomarkers, for example, you know, we had no idea what the mechanism was, in which patients it would go up, what the timeline was. And I think the more and more we use biomarkers, the more we use our clinical judgment and the alert systems that we built into the EMR, the more we'll have a better idea of just how best to care for these patients.
So small steps, but at least one little step every day.
Indeed.
And I think that our joint collaboration has been wonderful over the years and hopefully brought something good for our patients. And with this, I thank you for joining today Cappuccino in San Diego, and have a wonderful day.